unfortunately. Hi, everybody. Here comes the cowboy.
Jay, do you know if we have LJ for this today?
I think so, but I haven't heard from her since later yesterday, so I don't know for sure.
Okay.
I think she was planning to give a little bit more update about the school situation, was my understanding, but hopefully her shining face will appear momentarily. We'll give everybody another minute or so, and then we'll get going for folks who are just joining in. Seems like we've kind of flattened out as far as new joining, so maybe I'll just go ahead and jump in and we can get started and folks will join in. So welcome back, everybody, to the now, once again, weekly version of the talk. Puzzle. Oh, so we'll probably get to discussing that in just a moment, Kathleen. So lots of has happened. I will say the hottest issues seem to be mainly on the congregate care, hospital, home care side at the moment, but that is changing rapidly.
Just a Zoom thing,
Kind of developing. There has been a little bit of development on the.
whatever you two prefer.
Yeah, I really don't care about 3 months.
So we'll talk about that a little bit as well. But really just kind of what are we seeing from the community as far as illness? What are we seeing as far as mandates, governmental requirements? And then, what does this mean for us going forward for the next week? That's kind of how I think we'll start dealing with this for the moment. So as far as the virus itself, so no secret, we're pretty much all in high rate of transmission zone at this moment. So last week when I said that if you were in Yates, Wyoming, one of the county, wasn't most of us, but that you were in a high, the rest of us were in very high. Now we are all in very high and some of us are in extremely high rates of transmission zone. So it is definitely increasing in its preponderance, if you will. For the first 2 weeks of August, which we just got that data back from the state, 99% of all newly diagnosed cases were of the Delta variant. So it is not only increasing, but it is almost exclusively the Delta variant at this moment in time. So likely that is a large reason behind the transmission. We continue to see that the Amongst the vaccinated, this remains predominantly an illness of the older and immunocompromised. Amongst the unvaccinated, this is an illness predominantly of the 40 to 50-year-old category. But we are still, seeing more in children than we ever have before. But still locally, thankfully, that's still a relatively small number of cases comparatively. So all of this obviously is accelerating as we get back into the back to school window for us, and what those implications will be as we start bringing more unvaccinated kids into a congregate setting. However, we know from before that with masking mandates in place, which the state has now implemented, that we did very well during the last school year. Obviously, the transmissibility of the Delta variant is different than Alpha and Beta variants that we were dealing with at this time last year. But nonetheless, we still believe that the social distancing, masking, good hand hygiene, all those things are still of critical importance. From a vaccine availability standpoint, there is pretty much a nationwide relative shortage of the availability of the J&J vaccine. We know that there is a reasonable number of folks who are vaccine hesitant who will only accept the J&J. That number seemingly has declined. So if you go back a couple months, J&J was kind of a hot ticket, even though the news stories on J&J weren't always the greatest. It now seems that those two things have kind of caught up. There is a paucity of J&J available. The number of people who were wedded to J&J has decreased, but for those who remain, who have been vaccine hesitant up until this point, we're talking tens of vials of J&J available, at least within the U of R affiliate system at this moment. And a lot of the pharmacies and the like, I understand, don't have J&J available at all. So we are seeing that being the most limited availability. Most of the available vaccine, I think, is of the Pfizer and Moderna flavors at the moment. So file that away. There has been a lot of discussion in the last week since we last got together about the necessity and value of the boosters. So I'm going to stop on that for a moment. So for the immunocompromised, the advanced elderly, I think it is generally agreed that the booster is of significant value, regardless of what initial vaccine you got. That being said, there has been some fairly compelling evidence put forward that even though the antibody availability may be waning, that the cellular immunity is not being quantified, and that if you look at infection rates amongst the vaccinated, even with the Delta variant going around, it still seems that the rate of infection is pretty low, even in some pretty high-risk settings. So one of the questions is, does anybody really need a booster at this point? Is it too early for the non-immunocompromised, non-advanced elderly to be conceptualizing doing boosters? So even though we are still on track for it to come available, and we're still a couple of weeks away from the earliest of us potentially getting those, it's now somewhat of a debate as to whether there's really a necessity for it or not. Along with that, there has been some increasing, I'll say, disagreement amongst the data of exactly which of the vaccines are the most efficacious. So just yesterday, there was a reasonable study that came out that said Moderna may be the most efficacious against Delta. There's been some rumblings of that for a while. And now that data seems to be reasonably compelling in a decent sized population. That being said, the guidelines and recommendations from the CDC about which booster you should receive has remained unchanged. And it still is, you should get a booster of whatever series you got initially. So it's not everybody should get Moderna because of the Delta variant. Even though, as I said before, and I still think that this is true, if anyone were to walk into a vaccine providing location and they had both Moderna and Pfizer available, and someone were to stomp their feet and say, I will only take a Moderna booster, I suspect that you would get it regardless of whether you had Pfizer first or Moderna at this moment. So I suspect we'll get a bit more clarity in that recommendation on or before, again, like I said, September 20th is about the timeline that we're looking at. None of us should need it before that mark unless we're in the immunocompromised category, which is a different beast. But for those of us who are immunocompetent and otherwise well, I suspect we'll get a lot more data about not only should we get a booster, will they push that out further, or which booster we should be receiving. So more to come on that one. For those who are wanting it for the immunocompromised, it is fairly readily available pretty much in all corners, and folks can attest to it on their own. They don't need any special proofs or doctor's note. So even though I'm not suggesting that anyone should or needs to do such a thing, if any one of us today were to walk in and say, I am immunocompromised and I'm willing to sign that form saying so, they can get it at this moment. So it is readily available in the community. I just saw a chat about the booster. Hasn't been approved yet. So I have heard it will be approved for third dosing, but I have not seen official documentation that it is approved and ready to go as of X date. So yes and no, I guess is the easy answer to that question. So more to come on that. Like I said, I suspect we'll get a little bit more clarity on that in the weeks ahead. Next thing about vaccine, and this one is probably important just because it's, and I don't think anybody on this call will be surprised, but I am a bit shocked coming from the hospital side, how much we're hearing this kind of myth versus legend discussion that is prohibiting people who are vaccine hesitant from getting vaccinated. So as many of you know, with the approval of Pfizer, they listed the vaccine name, but then also the brand name, this Conriarty brand name. So there is a increasingly frequent urban myth going around that what was actually approved was a vaccine named Conriarty. It is not the Pfizer vaccine that everyone has received, and therefore this is kind of a bait and switch thing that the Pfizer vaccine is still under emergency use and this Conriarty vaccine is not available on the market. That is not true. As in any drug, they list the trade and generic name for the drug in the approval. This Conriarty has not been used up until this moment. It doesn't really matter at this moment because none of us are purchasing the vaccine from Pfizer. It's all coming out of governmental stores at this time. So there are many people who either are looking to find reasons to not trust the system or are just confused by the mountains of incorrect information. But I've seen a lot of nursing staff and the like who are afraid that this emergency use is not lifted for the Pfizer vaccine, and therefore they're not willing to move forward. So just so you know, it's out there. The brand name is listed in the FDA approval, but it is the entirety of the Pfizer vaccine. There's only one Pfizer vaccine that is currently in existence, and it is approved both under the brand name, but also under the generic name that has existed up until this moment, colloquially the Pfizer vaccine. So that's been a big thing, a big topic of discussion in the last week or so now as well. Now, as we kind of shift into kind of what are the most recent updates and governmental mandates and requirements, and what is this going to mean for all of us? So as of this moment, the mandate stands as it was currently discussed last week, that any healthcare provider that works in a licensed facility, whether that means you are an employee of the hospital or you occupy space within a hospital, must be vaccinated by the 27th. The state had taken that very hard line that not only by not meeting that mandate, that you would be terminated for cause as of that date by your employer, but also that terminate with cause would likely preclude you from receiving unemployment benefits and would require that there be a report filed against the licensure of any licensed provider who did not comply with the mandate. That has softened a bit. There's a bit of uncertainty, and I will tell you, obviously people are pretty savvy. There has been a large question of, okay, what if I resign now, as of today? I could have resigned at any time for any purpose, then you could not terminate me for cause. You could not restrict me from applying for unemployment benefits. You could not file anything against my license. And that appears to be true from everything we've heard from labor attorneys and the like. So many folks in hospital congregate home care settings are starting to either get resignations from folks who are trying to get ahead of the deadline, or are hearing rumblings that people are planning to resign with enough time to give adequate notice to avoid termination with cause and reporting against their license. So that's been an interesting development. The other thing that has developed, and you probably heard this yesterday, Governor Hochul has at least voiced, does not put it forward yet, that they plan to mandate that anyone who works in a school, but teachers in particular, would be mandated to get vaccinated or submit to weekly testing. Now, that's obviously a different approach than what has been taken in the hospital settings. I can tell you hospital and nursing home leadership across the state has taken that as a sign that the governor may be willing to soften this mandate a bit because of the risk that appears very real that we could see a significant reduction in healthcare workforce in those congregate care settings. So I can tell you that that discussion continues as we speak. Haney's Hospital Association of New York State is actively engaged. As recently as this morning, they had asked for a hospital by hospital report of what service line impairment they would see if the mandate were to go into effect as currently stated. And they are actively working with the governor's office and the Department of Health to kind of do an assessment of what the public health implications would be if those service line effects went into place. So it appears that there may be some softening of this mandate, but at the same time, we do know that I do not think we're going to see mandates going away completely. I anticipate, and the word on the street has been from the governor's office and Department of Health, they will continue to look for ways to mandate for all state employees, all healthcare workers, all education workers to comply with the mandate or testing at some regular interval. So we'll see where that goes, probably in the days ahead, quite honestly. There have been a host of healthcare workers, teachers groups that have filed suits against the state, questioning the authority and the constitutionality of the mandate. I can tell you right now, from everything I've heard, the state feels very confident that the mandate will withstand any of those legal charges. And they are not expecting that to have significant traction, except with the religious exemption. And it's been an interesting discussion in the last several days that where the state had come out with the committee approval and said that they would remove the option of religious exemption in the last several days. That has now 180, and it appears that due to federal mandate of allowing for religious exemptions, that may trump the state mandate, no pun intended there, that may trump the state mandate of disallowing religious exemption for this vaccine. So it's a bit of a question as to whether the religious exemption will be put back into the mandate to allow for medical exemption and religious exemption. If it is put back, it is also unclear as to how specific that religious exemption can be. Remember before, the religious exemption was you had to state your religion, you had to have the note signed by your minister, priest, whoever oversaw your religious doctrine. You had to cite the doctrine in your religious beliefs that precluded you from vaccination, and you had to provide proof that you did not receive other vaccines because of your religious beliefs. So it was a pretty strenuous bar, and I think most all of us felt very uncomfortable starting to get into a theological debate with someone about whether their religious doctrine stood or not. So we're still waiting some guidance from the DOH and state about that. But that has swung wildly in the last, I'll say, 4 or 5 days. And right now, I would say it's tenuously back that there will be some allowance of a religious exemption. As far as any legislation being introduced to date, remember we talked last week that there had been word that there was going to be legislation mandating vaccination for all healthcare workers, regardless of congregate care setting, private practice, and the like. I have not seen or heard that being put forward as of yet. So that remains to be seen where that will go. But for the moment, private practices who do not, their practice is not located on or within a hospital building or grounds are not subjected to the mandate at this time. And believe you me, I can say from my own experience, nursing staff in hospitals are aware of that, and we're seeing people applying for private practice nursing and other jobs, trying to find a way to maintain their healthcare employment within New York State. But the intent is that that will not last long. The other piece to this that I will tell you is that one of the big concerns is there would be an exodus of healthcare workers from New York State, and they would go to the neighboring states that do not have mandates. All of the neighboring states surrounding New York have voiced that they will likely be implementing some mandate themselves. And in fact, I've heard, although I've not seen official word yet, that Pennsylvania Department of Health plans to put forward a mandate any day, and I thought it was coming yesterday, to say that any new healthcare workers would have to provide proof of vaccination prior to hire. So that someone coming into the state couldn't just leave New York because they wanted to avoid the vaccination standard and go to Pennsylvania and work because any new hire would have to show proof of vaccination. So we're probably going to see a lot more of that start to play out in the next week or so. I think everyone is kind of waiting for everyone else to kind of make some of these final determinations and see what some of the, I guess I'll say, more liberal states like New York opt to do. Because, you know, states where there's a bit more conservative nature like Pennsylvania certainly don't want to get out ahead of New York State because of the political ramifications of something like that. So it's going to be an interesting game of cat and mouse here over the next several days to weeks to see who shoe falls first and what the ripple effect of that is. So that's where we stand right now with the existent mandate. The anticipation is that Governor Hochul will likely put forward her recommendations in a bit more written form, likely within the next week or so. That we may start to see revisions as soon as the next couple of days. The next big hearing about the mandate as it currently exists is tomorrow. And so the anticipation is between the survey that Haynes was asked to put together by the governor's office today and from the discussion of the mandate tomorrow, that we may see some movement that follows shortly thereafter. And Renee and LJ, I see you giggling. If you're laughing at me, we're going to fight. So,
Not laughing at you. Just threw in a private text that I had to go to CVS real quick.
Sorry, I tried to put my hand up when I started to when I realized, I was like, why does she have to go to CVS? And then I got it. It took me a
So
while.
as soon as you're talking, I was like, what did I just say that made people giggle?
No, it wasn't you at all. Sorry.
So that's what I know right now. When I say that this changes by the hour, it literally changes by the hour. This is so fluctuant at this moment that I everything I just said will not be true by the time we finish this call, quite honestly. And that is not an over exaggeration. It has literally been that volatile over the last couple of days. Unfortunately, that is making people extraordinarily uncomfortable. And I think we're left in a position where, from a public health and healthcare provider standpoint, I think all of us are widely in favor of vaccination and want to see the vaccine or the vaccinated status of the state continue to increase, because I think we all agree that is the fastest and most likely way that we will contain spread of COVID in general, but the Delta variant in particular. That being said, there is a reality that, right or wrong, reasoned or not, there is a significant section of this state that exceeds 20% of our own workforce who will not, due to reasoned or unreasoned purpose, comply with this mandate. And the idea that we could lose 20% plus of our workforce is really just untenable. We're already in a nationwide healthcare worker shortage. And to drop potentially another 15 to 20% just is not realistic. So, I think we are going to see a game of chicken that plays out here as to who bends soonest. And I suspect, based on what we're seeing, that it's probably going to be the government that's going to bend faster than anyone. But I could be wrong about that. I hope I'm not. So more to come. But truthfully, we could have these meetings every 30 minutes and still not be able to keep up with the pace of play at this time. The final thing, as far as what this means for us going forward, I think that probably already, I would not be surprised if many of you are getting inundated with requests from staff or from healthcare workers who are employed by hospitals, congregate care settings, or home care agencies, because they are looking for medical exemption to the mandate. I will tell you that even at this moment, I told you last week, I anticipated that we would have an answer to the medical exemption by Thursday. I'm going to tell you the exact same thing today, that it is a week later, and I'm still anticipating that we will have further clarity of the medical exemption by Thursday. I will likely be wrong again tomorrow, because this seems to just keep getting kicked down the road, because I think everybody realizes once they put that stake in the sand, bad things start to happen, and people start to either find avenues around, or there were unintended consequences that they didn't foresee. So to everyone's credit, I think people are trying to get this right on the first shot, but unimaginably, the ripple consequences of all this is unbelievable, unlike anything I've ever seen before. So it's almost impossible to attend to every possible effect of anything that changes minute to minute. I will tell you that the uncertainty has created a significant degree of anxiety amongst everybody. Private practices are waiting for the shoe to fall and for them to be included. Hospitals are worried that they're not going to be able to maintain operations and continue to serve their communities. Nursing homes are actively trying to hold on as best they can, and worried that the federal mandate supersedes their state mandate, and that they could potentially have to confine or close services altogether, meaning that there's even more patients who get sent to the hospitals and crowding those already crowded facilities. So it is, I would say, what was a well-intended, hope to be well-intended effort to put forward this vaccine mandate has really brought us to the precipice between increasing numbers of hospitalized individuals and decreasing amount of staff, and uncertain staff who were just fed up and looking to flee healthcare once and for all, or flee the state at minimum. We're in a pretty tenuous position, I would say, at this moment. And something's going to have to start happening fast, or else, people are going to start moving because of just the uncertainty becoming overbearing for them. So lots is going to change. If you want to pop Xanax and drink heavily, let me know. I'm probably going to have that party any day now, because it's just gotten to that point that the stress from this is getting pretty significant, to say the least. So I know several folks have reached out with questions. Everything I just said is pretty much everything I know, but it really is changing quickly. So I think that's all I can really say at the moment. Everything else is actually pretty much just hunky-dory and cruising right along, no issues at all. So the hospitals are reaching capacity. I think everyone wants to join the Xanax and alcohol party, so come on over. So yeah, I think the next wave of this is going to be, we are seeing a few congregate care settings, even group homes where folks were vaccinated, where we're starting to see COVID spread, and some of those individuals are being hospitalized because of symptoms, or because those congregate care settings can't care for them. Likewise, we're starting to see nursing homes that have just reached a critical mass and shortage are starting to lose staff who are resigning, and so they are finally having to at least close beds, close floors, or looking towards consolidating into fewer facilities overall. So I think we're gonna start to hear over this next week how much hospital capacity is becoming a premium. Because those congregate settings are gonna start loading up the hospitals at the same time that we're still seeing increasing numbers of COVID patients coming in. So that's gonna be a big storyline for the next week or so. You know, I do think, and I don't think we need to go out and start alarming the general public at this moment, but I am surprised and impressed that the lay person on the street seems to be largely unaware of most of this. They know that Delta variant's picking up. You know, they haven't heard much about this vaccine mandate. They don't have any comprehension that this could affect care delivery, which, you know, I think is good. I think if the average person in the community were understanding that their EMS service may not be able to respond because they don't have adequate staff because people are leaving, or, you know, hospital wait times could become dramatic. You know, I think it would just incite more panic and concerns. It's probably better that it hasn't caught on yet, but I think if we start hearing about nursing homes closing and the like, I think public awareness is going to peak, and so people will start being more attentive to that. So that's really what I think is we're going to see in the week ahead. Probably more clarity around the vaccine. I think some nursing homes are already past the point of no return, and we're probably going to see some ripple effect about hospitalizations because of it. Hopefully, the changes in the vaccine mandate will be protective to private practices, because I think they're having a hard enough time enforcing it in the licensed article agencies that I don't think they're ready to get out over their skis and try to start extending into private practice settings yet, unless they find some new justification to maintain course, which seems that they're losing that, if anything. So with all of that, I realize I gave you no concrete information whatsoever, and I apologize for that. But we are a house of cards built on sand at the moment, with rising tide and hurricanes all around. So with that cheery note, I will turn it over to LJ.
Thank you, Pollyanna. That was quite something. So I'm just going to talk a moment about schools reopening. Many of you who are on the call, I recognize, were likely on the recent schools reopening task force open forum for health and education that was held last Thursday. But I'm going to give you the rapid fire Reader's Digest summary of that for those who were not. And then also let you know that for our pediatric and family medicine practices, we do have a PCP advisory group meeting tonight. We decided to cut that meeting to a 1-hour meeting and have it be pretty much a question answer discussion forum around things that are critically important to you. So the schools reopening piece, rising COVID rates. We do not have a big AHP quote unquote agenda, but wanted to have the opportunity for you all to talk to each other and be able to share what information we have. So just know that's coming this evening from 7 to 8 for those who are representatives on that group. In essence, in terms of schools reopening, much of what all of you are doing for kids is going to remain the same. So we were kind of waiting to see if there were going to be dramatic shifts in protocols. There still is the potential that there is going to be some additional recommendations that come from the Department of Health. The Department of Health had not released anything under the former governor, but we're very hopeful that it will actually come out and be aligned with state ed this time and with CDC. And so that remains to be seen. So just like Chad said, I could be all wrong in everything I say, but we're going to say that this is the truth for the moment. The biggest difference, quite honestly, is most of the districts are not having any of the daily symptom screening check-in, whether it was electronic or paper or whatever schools had done last year. They've all pretty much left that out. And there's an assumption, it's the honor system. There's an assumption that families will screen their child for symptoms. If their child is sick or has a fever, they will stay home, they will seek medical consultation, but you're not going to have that layer of sort of the automatic catch. So we'll see what happens with that. I think that some people wondered how effective that really was, or how many people just hit no for all symptoms and sent their kids anyway. The schools, nurses, if a child presents with any illness symptoms, they are going to be using the same symptom list. And I know that many of you were advocating for, could that list be pared down? Could it be different? Could we get rid of this? Could we get rid of that? We really can't at this point right now. And I think for any of you who couldn't attend the meeting, I think it actually was really very informative. And Brenda Tassini did a lot of explaining about why it's important right now to still be very vigilant about all the symptoms, because with the Delta variant and with more cases in children, because children are not vaccinated, we still just have to be hypervigilant and make sure we're really screening. To that end, alternate diagnosis really, there's very few, right? It's really, if you have a kid with confirmed strep or confirmed mono who has no respiratory symptoms with that make it look a little iffy, those are the things that might be able to stand. As I say that, that's like a lab confirmed diagnosis, right? If you have concerns about flu, if you have concerns about RSV, other things, you should be testing for COVID too in these kids. So err on the side of testing rather than not testing, similar to where we were last year when we had higher rates of infection in the community. There are alternate diagnoses like a UTI or things like that that make a lot of sense. I think use your clinical judgment on that. And I think that the nurses will be appreciative of that. We have asked the school nurses specifically, and we're reiterating it again this week and next week, not to tell families just to go and get a test or just to go and get an alternate diagnosis. That was something that happened a lot last year. It's particularly in the last month or last 2 months of school. We're trying to avoid that and trying to have people aligned as to the importance of actually getting a medical assessment, and then really working together around that and trusting the guidance of the physician, not to have families anticipate what you're going to do when that's not what you would normally choose to do. For chronic illness, remember again, if you have a child who has chronic illness, it's a child who's got an increase in symptoms or a significant worsening of their symptoms. Those are the ones where you should be still thinking about COVID. GI symptoms are still on the list, not abdominal pain, but certainly diarrhea, vomiting. Those kinds of things are still on the symptom list. Testing. The community standard for testing remains PCR, and that was reiterated about 5 times on the call. Because I think a lot of people are feeling like, why can't we just use this test or that test? I've heard it might be even better with the Delta variant. To be as uniform as possible across the community at this point, PCR is considered the standard. And so that's what we'll hold for a patient if they're coming back into school. I know that some of you have rapid PCR. Please note, if you're sending a note back for a child to return to school, please note that it is a PCR test. That's the thing that the nurses are going to be looking for. Trying to think of other things. Return to school for kids in terms of physical activity. There are no substantive changes to that cardiology algorithm that was developed in collaboration with primary care and with Peds Cardiology, with the team in Buffalo as well. I think the biggest thing is, remember, we could Renee, maybe we could just re-up that again today in the mailing, just to point that out. And I would just guide people. The best thing to do is we'll just provide the link back to the GCH website, because that's where the most updated version is. But keep in mind that the workflows for Peds Cardiology remain the same. They'll get those kids in quickly if you need to, but it's really the 12 and older that require a bit more assessment. It's the kids who are participating in competitive sports or really rigorous activity who need the actual gradual return to play if they had moderate or severe symptoms, or if you're screening and you're identifying that they have symptoms. And the last thing I just want to mention is, I probably don't need to mention this to any of you because I'm sure you have been the recipient of lots and lots of calls from families wanting a medical exemption for their child so that they do not need to be in-person school. So as a community, and this is across independent practice, across the GCH, the RRH practices, and the specialty practices who do primary care as well, like adolescent medicine or developmental behavioral peds who end up caring for patients, not just in a subspecialty fashion. Everyone is in agreement. These kids need to be back in school, and that medical exemption would really apply to only a very tiny subset of patients. And these would be kids who really have got such significant immunocompromised that you wouldn't be sending them to school in person, even if it wasn't COVID. And so the recommendation is to engage the specialist. We're trying to allow primary care docs to be able to say there really aren't any medical exemptions that would be relevant from a primary care standpoint. That would be something that would be negotiated with your specialty provider. So I just want people to know, because questions had come up, we have communicated that, and I'm communicating that again today in an email to all of the specialty faculty. I will tell you that on a GCH meeting yesterday, Beth Marston, who most of you know is a MedPeds rheumatologist, made the point that she puts kids on immunosuppressives all the time, and all those kids should be going to school. She's not writing medical exemptions for them as long as they're using the appropriate mitigation strategies. So I think there's a lot of uniformity. The developmental peds team has said they are not writing letters of medical exemption. Because at this point, with being out for this long, the greatest risk to these kids, quite honestly, is all of the learning loss and the social, emotional, mental health risk that this continues to place on them. That being said, it's really important to reinforce to families that the mitigation strategies in school are there for a reason and they should be followed. So I'm going to try to share my screen, and I just want to show you, I mentioned a letter last week. Those of you who didn't get the letter, it's because it went through a whole bunch of revisions because everybody had to agree to the letter. But I have it now. We'll email you, those of you who reached out to me. But we also asked the Rock the Future team to prepare an infographic that people might be able to use for talking points or to post to their website or to post wherever. So if you like this, if you would like to use this, you don't have to. But this talks about the benefits of in-person school outweighing the risks of COVID-19 for most children. It highlights the AAP statement that opening schools does not significantly increase community transmission of COVID-19 because of the mitigation strategies. It goes over that schools are working hard to make classrooms safe and families can help. And it hits on those things, hits on masking, it hits on health and safety rules, it hits on vaccination and really making the point. It's not just vaccinating kids who are eligible, but adults who are in contact with them, that it's important. And then it does highlight the point of keeping your kid home and then seeking medical assessment if they are sick or they have symptoms. And then on the sidebar, you can see there, it does talk about that your child specialist would work with you if you have a severe medical condition. So we were really pleased, a letter is something, but this is something that may catch people's attention and help them. So Renee's gonna put that, stop sharing, sorry. Renee's gonna put that into our mailing from today too. So if any of you would like to, utilize that or utilize that for your staff for talking points, because I know this has been a really tough issue. It's like taking the requests for mask exemption up to a whole new level. I know you have families who are angry. The schools have families who are angry. The schools have lawsuits against them. The schools have had horrific board meetings with people coming in and screaming and swearing at them because they're forcing their kids to mask, because they're forcing whatever. I personally have no tolerance left for any of that. And I think as vocal as you can be, as forward as you can be, and as directive as you can be about the responsibility that we have as a community and the importance of kids being back in school, please be vocal and please do what you can to educate your families. And I think that's it. I saw a couple of questions go into the chat. They look like they were getting answered at the same time, but Yes, the question was update on under 12 when under 12s will be vaccinated. Steve Cook on that forum said that there is some hope coming from Fauci, having said that hopefully late fall, but depends on what you read. I mean, I've heard everything from, after the first of the year to late fall. It's certainly not going to be for the first few months of school. We don't anticipate. I think that's it for me. Renee, have you got anything?
Nothing for me, other than just another reminder that pediatric PCP advisory committee is tonight. Hope to see many of you on that call tonight, starting at 7.
Perfect. So good time to plug. So we have the behavioral health webinars that go on weekly. So those are continuing. We're going to continue to do this weekly for now. Obviously, if something exciting changes, we'll try to keep you up to date either electronically or if we need to call together a meeting, we certainly will. With that, I think we have run the chat room. So if folks have questions, happy to take them live, or if you wish to chat, we'll respond to those as well. Or if you just want to get on the invite list for the benzo and alcohol party, taking a list right now too. All right, seeing and hearing none. Thank you guys very much. There will be more to talk about in the week undoubtedly.
Have a nice holiday weekend, everyone. Bye-bye.
Yes, absolutely. Take
Hi,
care.
everybody.
Bye-bye.